A loud bang picked up by your ear, you felt a sensation somewhat similar to a punch in your chest, staring at a bleeding hole nearly 1/45 of an inch in diameter located on your torso. Breathing is becoming increasingly difficult. Darkness is about to set in at any moment. What should you do? Hello, my United Incels. This is your host, Uncle Chin, teaching you some first aid skills, including how to treat a ballistic trauma to your torso. Back to our story. You're thinking your life on God's green earth is about to end. How long will you have before your body becomes ambient temperature? Should you lie down? Should you call for help? Should you pull out your phone and start recording your last words? We'll find out. The first thing to do is get yourself to safety. If you're in a gunfight and your assailant is relentlessly pursuing you, then you need to end that threat immediately by fighting back or aggressing. Charge and fire at your attacker if you have a weapon in hand, or fire back to cover your retreat. Only after you are safe, then you can focus on treating your wounds. Once the adrenaline in your bloodstreams released by your body due to flight or fight response wears off, you will feel the oppressing pain kick in. You should treat your wounds as early as you can. Contrary to many Hollywood films, your first step should not be trying to remove the bullet or pull out the object if you've been stabbed and the object remains. That will only induce severe bleeding and your ultimate demise. Most death trauma patients lose their lives due to blood loss, as blood carries oxygen throughout your body to maintain every organ's function, including your brain. Your brainstem is responsible for autonomous breathing. See, it's a vicious circle if you let those bodily fluids go. You can find a clean piece of a cloth to put over that hole while maintaining pressure. Do it. Surround the stab wound near the object if you've been stabbed. You're trying to have that blood clot and seal your wound. A dirty rag or duct tape or anything similar will do the trick. You may get infected, but that will happen within the following days. Your objective is to save yourself until ambulance or your teammates arrive, assuming you're a soldier or a combatant. Infections can be treated later using antibiotics. After stopping the bleeding and moving to a safe location, you may be tempted to pull that dirty rag out. Doing so will break the blood clot that's preventing a red river, sending you back to step 1. Worst case scenario, if you're caught without clothes, use your hand to cover the wound and apply pressure. Wait, after taking a few stabs and I find it substantially hard to breathe. I've done the above, but why the heck is this happening to me? Your lungs are collapsing as you ask this question. See, your lungs are sealed in the back of your chest, free of external pressure, so your lungs can inflate and deflate safely. Any punctures to your chest will draw in air as your lungs deflate to exhale, compressing against your lungs and causing them to collapse. The condition is called pneumothorax. You can recognize one by looking for bubbles or foam in the blood that's bleeding out as you exhale. If you have a credit card or a piece of plastic, then place them on your wound immediately. This will prevent further air from entering your lung cavity. Your hands would be the last resort if you don't have any resources. If you've been hit multiple times, focus on the one bleeding out the most. Muscle wounds tend to stop bleeding on their own due to a lack of blood cells in the area. Torso wounds bleed out the most, and it will cause pneumothorax. Hopefully, with the information presented above, you will be able to prevent yourself from dying if shot or stabbed. Practice is key, and performing life-saving procedures is increasingly difficult under stress.